Stool stuck in the rectum. What is it and what to do? It's a deeply private and often distressing experience that far too many people face, yet rarely feel comfortable discussing. Perhaps you've been there yourself, sitting in the bathroom, feeling an undeniable urge to go, a sense of pressure and discomfort building. But despite your best efforts, nothing seems to happen. Minutes stretch into what feels like an eternity, 30, 60 minutes, perhaps even longer. You can sense the presence of stool, the distinct feeling that something is undeniably there, but your body simply won't respond in the way it usually does. Eventually you give up, walking away feeling utterly frustrated, maybe even a little defeated, telling yourself, "I'll just try again later." But when later arrives, the same disheartening scenario unfolds, repeating itself again and again. If this frustrating and painful cycle sounds all too familiar, it's vital to understand that this isn't just your typical run-of-the-mill constipation that a simple home remedy might resolve. My name is Dr. Michael Adeyemi, and today I want to delve into what it truly signifies when stool becomes trapped or stuck in the rectum. This isn't just an uncomfortable inconvenience. It's a condition that can be far more serious than many realize, particularly for individuals over the age of 60. We'll explore the precise reasons behind it, using real anatomical explanations and offering a clear step-by-step guide on exactly what you should do if you find yourself in this situation. I understand that discussing such a personal topic can feel awkward or even embarrassing, but please know that your health and well-being always come first. If even a small part of what I'm describing resonates with you, I encourage you to type yes in the comments right now. You are absolutely not alone in experiencing this, and by sharing your experience, you help more people who might be silently struggling find this important information. Understanding what's happening inside your body. To truly grasp the seriousness of this condition, let's paint a vivid picture of what's unfolding within your digestive system. Forget the dry diagrams in a textbook. Let's imagine a scenario that I hope makes this immediately clear and understandable. Think of your large intestine, also known as your colon, much like a long winding river that has for many years flowed beautifully and consistently. The water within this river moves steadily and gracefully, ensuring that everything downstream receives what it needs without interruption. Now, imagine a gradual, almost imperceptible shift over the course of a week or so. The river's flow begins to slow down. Perhaps there hasn't been much rainfall recently, leading to a subtle dry spell, or maybe some natural debris, leaves, branches, sediment, has slowly started to accumulate in a particularly narrow bend of the river. The river doesn't just stop flowing overnight, instead it decelerates, slowing down more and more with each passing day. Eventually, this accumulated debris becomes so densely compacted at that specific bend that the water literally cannot push through anymore. The blockage is complete. This river, in our analogy, is your colon, and that compacted debris represents what is known medically as a fecal impaction. While fecal impaction might sound like a clinical, somewhat distant term, I want to explain what it truly means in simple, everyday language, because I believe the medical jargon often leads people to underestimate just how profoundly serious and potentially dangerous this condition can be. Your large intestine is essentially a muscular tube spanning several feet in length. Its primary role in the digestive process is twofold. First, to systematically move waste material toward the exit point, and second, to efficiently absorb water from that waste material. Under normal, healthy circumstances, this is a marvelously efficient, almost automatic process. Waste moves along its path, water is absorbed, and the stool maintains a soft, manageable consistency, allowing it to pass comfortably and regularly. However, this is precisely where the natural process of aging can significantly alter the game, and this is a crucial point that I hope every person over the age of 60 who is watching this video will truly take to heart and internalize. As we gracefully mature, several interconnected changes begin to occur within the digestive system, often happening simultaneously. First, those vital muscular contractions that rhythmically propel waste through the colon, the gentle wave-like squeezes known as peristalsis, tend to slow down. It's like the river's current becoming weaker. Second, the delicate nerve signals that orchestrate and coordinate these contractions can become less efficient, losing some of their precision and speed. Think of it as the communication system within the river becoming a bit sluggish. Third, our natural sensation of thirst can diminish with age, meaning that many older adults may unknowingly experience mild, chronic dehydration without ever feeling thirsty enough to drink the necessary amount of fluids. This lack of hydration has a direct and significant impact on stool consistency. Compounding these natural changes are the medications. Many of the most common prescriptions for individuals in their later years, drugs for blood pressure, iron supplements, calcium channel blockers, certain pain medications, and even some antidepressants can have a direct side effect of slowing down bowel motility. They essentially put the brakes on your digestive system. When you bring all these factors together, slower muscle contractions, less efficient nerve signals, subtle dehydration, and the influence of medications, you create what I describe as the perfect internal environment for stool to move through the colon far too slowly. When waste material sits in the lower segments of the colon for an extended period, it loses an excessive amount of moisture, gradually transforming from something soft and easily manageable into a dense, dry, and essentially immovable mass. By the time this material has been sitting for 5, 6, or even 7 days without being fully passed, it has dehydrated into what can only be accurately described as a hard, solid mass. And when this hardened, unyielding mass eventually reaches your rectum, which is the final storage section just before the anus, and it simply cannot fit through the exit, you are experiencing what is medically defined as a fecal impaction. The intense pressure you feel is not imaginary, it is absolutely real. The profound exhaustion and discomfort that comes from straining, often for extended periods, is also entirely real. And the deep-seated fear that something is seriously wrong with your body is, I assure you, completely justified because something is seriously wrong. If you're finding this information helpful and learning something new, please take just a moment to hit that like button. It helps us reach more people who need this vital health information. Why this is far more dangerous than you think now, I want to spend some dedicated time on this next point, because this is the aspect that often catches people completely off guard. When individuals hear the term constipation, they typically associate it with something inconvenient, uncomfortable, but ultimately harmless. A fecal impaction, however, is neither of those things. It's a serious medical condition that demands immediate attention. Let me walk you through the cascade of events that can begin to unfold inside your body when a large hardened mass of stool becomes stuck in your rectum for an extended period. The first and most immediate concern is what we call structural pressure. Your rectum, while designed to be a flexible and expandable structure, is absolutely not meant to indefinitely hold a cemented, dehydrated mass of stool. It has very real limits to how much it can stretch and distend. When it is chronically overdistended by an impaction, the delicate blood supply to the tissues lining the walls of the rectum can become severely compromised. The cells that make up that vital lining rely heavily on a constant, healthy supply of oxygen and nutrients carried by the blood. When this circulation is either cut off or significantly reduced for too long, those cells begin to struggle, becoming damaged. In particularly severe or prolonged cases, this can unfortunately progress to significant tissue injury or even necrosis, tissue death, that requires urgent medical intervention and specialized care to repair. Now here's a piece of information that genuinely surprises most people when I explain it during a clinic visit. Your rectum and your urinary bladder are very close neighbors within your pelvic cavity. They share an incredibly confined anatomical space, separated only by a relatively thin, fibrous wall. When your rectum becomes densely packed with a solid, rigid mass and is stretched well beyond its normal, healthy capacity, it physically pushes and presses against the urinary bladder. For women, this pressure is often even more pronounced due to subtle differences in pelvic anatomy. What patients often experience as a result is a sudden, confusing, and often painful difficulty with urination. They report a persistent feeling of constantly needing to go to the bathroom, but when they try, they can only pass a few painful drops, or in more severe cases, they may be unable to urinate at all. I have personally had patients come into my clinic genuinely convinced they had suddenly developed a severe bladder infection overnight, only for us to discover that the real underlying cause was a rectal impaction that was physically compressing their bladder from behind. Once we successfully addressed and cleared the impaction, their urinary symptoms completely resolved, much to their relief. But we are not done yet, because there is one more critical symptom that I absolutely must warn you about. This symptom is so profoundly confusing that it frequently leads people to actually make their situation dramatically worse. It is known as overflow incontinence, and on the surface, it looks, sounds, and feels exactly like diarrhea. Here's precisely what happens. The solid, hardened mass of impacted stool creates a complete blockage, effectively sealing off the main exit pathway. However, your intestines higher up in the digestive tract are still diligently producing liquid waste. Because the primary route is blocked, this liquid waste has nowhere to go except to seep around the outside edges of the hard, unyielding blockage, much like water, finding a tiny crack in a dam and slowly leaking through. This liquid then leaks out unpredictably. People experiencing this see the liquid stool and understandably think, well, I clearly don't have a blockage, I'm having diarrhea. And then, tragically, some individuals will go to the pharmacy and purchase an anti-diarrheal medication to try and stop it. This, I cannot stress enough, is one of the most dangerous and counterproductive mistakes you can make in this particular situation. Anti-diarrheal medications are designed to slow down or even temporarily paralyze the natural movement of your intestinal muscles. If you take them, you will be shutting down and paralyzing the very mechanism your body is attempting to use to work around the existing problem. You will, in essence, be cementing that impaction even more deeply and firmly into place, making it even harder to pass. I strongly recommend that you save this video right now. You might not need it today, but if this situation ever happens to you or someone you care about, having this step-by-step guide readily available could truly make all the difference and potentially prevent a serious medical emergency. If you are experiencing what appears to be diarrhea, especially if it's accompanied by days of feeling like you cannot fully empty your bowels, please consider the possibility that it is overflow incontinence, not true diarrhea, and absolutely do not medicate it without first speaking to a doctor. Why seniors are at dramatically higher risk. I want to speak very directly to my older adult viewers here, because the statistics on this particular condition are quite sobering and unfortunately are rarely discussed in mainstream health content or general conversations. Fecal impaction is not a condition that is evenly distributed across the population. On the contrary, it disproportionately affects adults over the age of 65, and the risk significantly increases with each passing decade of life beyond that. To put this into perspective, in nursing home and long-term care settings, some studies indicate that fecal impaction affects a staggering upward of 40% of residents. It stands as one of the single most common gastrointestinal emergencies encountered in geriatric medicine. Yet, despite its prevalence, it is also, encouragingly, one of the most preventable conditions, provided that people understand what factors contribute to its risk in the first place. Let me outline the major risk factors that are particularly specific to older adults. One of the most significant factors is reduced mobility. When we move our bodies, whether it's through walking, engaging in exercise, or even just performing light housework and standing, we are mechanically stimulating our entire digestive system. The simple rhythmic act of walking, for example, creates gentle, natural pressure in the abdomen that plays a crucial role in helping to keep intestinal contents moving along their path. When mobility decreases due to conditions like arthritis, recovering from a recent surgery, experiencing a fall, or any other physical limitation, that invaluable mechanical stimulation largely disappears. As a direct consequence, the colon's activity slows down considerably. Dietary changes also represent another key contributing factor. Many older adults find that their appetite naturally decreases as they age, leading them to eat smaller meals. They may also consume less fiber-rich foods, and critically, they may drink less water. This reduced fluid intake is partly because the intricate thirst mechanism, which typically signals to us that we are dehydrated, becomes less reliable and less sensitive with age. All these dietary and hydration changes collectively reduce both the bulk and the moisture content of the stool, making it far more prone to hardening and becoming difficult to pass. Then there are the medications. This is a conversation that I strongly encourage every single person over 60 to have openly and honestly with their doctor or pharmacist. Many of the most commonly prescribed drugs for older adults have constipation as a direct and well-known side effect. This includes, but is not limited to, opioid pain medications, certain types of antidepressants, antihistamines, iron supplements, calcium supplements when taken in high doses, and diuretics, which increase fluid loss from the body. If you are on multiple medications, which is a very common scenario for many of my older patients, the combined constipating effect can become incredibly significant and challenging to manage. Finally, there is the often overlooked issue of suppression. Many older adults grew up in an era when discussing bowel habits was considered deeply private, even taboo. Consequently, they may feel the urge to defecate but find themselves not at home, or perhaps it's simply an inconvenient time. So they suppress the urge. They wait. Repeatedly suppressing that natural urge over months and even years can unfortunately retrain the rectum to become less sensitive to the signaling. The urge to have a bowel movement becomes less frequent, less urgent, and as a result, waste material sits in the rectum for longer periods, contributing to its hardening. Understanding your own specific risk factors is truly the very first and most empowering step you can take toward preventing this incredibly uncomfortable and potentially dangerous situation from ever repeating itself. Before we delve into the exact step-by-step solution, please make sure you are watching this in a place where you can focus without distraction, because the information I am about to share with you could very well help you avoid an emergency room visit. The Emergency Action Protocol. All right, by now, you have a clear understanding of what a fecal impaction is and why it happens, particularly as we age. Now let's talk about the practical, immediate steps you should take if you are currently in the midst of this challenging situation. The very first and most crucial instruction I want to give you, and I need you to hear this with absolute clarity, is this: stop straining. I know it feels completely instinctive. I know your body is likely screaming at you to just push harder, to push more, to try a different angle or posture. However, here is the physiological reality of the situation. A solid, severely dehydrated impaction does not respond to pressure from above in the same way that normal soft stool does. It is simply too rigid, too dense, and too firmly lodged. What additional straining actually accomplishes is a significant increase in the risk of causing painful conditions such as hemorrhoids, anal fissures, small tears in the anal lining, or even, though rare, a serious condition known as a Valsalva syncope, a sudden, dangerous drop in blood pressure brought on by excessive straining that can lead to fainting. For older adults who may have underlying cardiovascular conditions, aggressive straining can also place a dangerous and unnecessary strain on the heart. So please stop straining, take a deep breath, and let's work through this systematically and safely. Step 1. Glycerin suppositories. Your first course of action should be to go to any local pharmacy. You do not need a prescription for this. Purchase adult glycerin suppositories. For a hardened impaction in an adult, a single suppository is often insufficient to achieve the desired effect. Therefore, in consultation with a healthcare provider or by following established clinical guidance, many practitioners recommend using 2 to 3 adult-strength suppositories simultaneously for an established impaction. Here's precisely how to administer them for maximum effectiveness. Positioning. Lie comfortably on your left side. It is crucial to be on your left side, not your back, and certainly not sitting upright. This specific position works synergistically with your body's natural anatomy, particularly the gentle curve of your sigmoid colon and rectum, to help direct the medication precisely toward the impacted mass. Lubrication. Apply a generous amount of water-based lubricant to each suppository before insertion. Please do not skip this vital step. The surrounding tissue in your rectum is likely already irritated, inflamed, and highly sensitive due to the impaction. Proper lubrication will make the insertion far more comfortable and significantly more effective. Insertion and patience. Insert the suppositories gently but deeply into the rectum. Breathe slowly and steadily throughout this process. And then, and this is the critical part where most people unfortunately fail, do not move. Stay lying on your left side, remain as still as possible. Set a timer and wait a minimum of 30 to 45 minutes. Glycerin suppositories work by actively drawing moisture into the stool from the surrounding rectal tissue through a process called osmosis and by providing essential lubrication to the rectal walls. It absolutely needs this dedicated time to begin softening the outer layer of the impacted mass before any movement can realistically occur. If you rush to the toilet after only 10 minutes, you will very likely only expel the suppository itself, and the impaction will remain exactly where it is, unchanged. Step 2. The second attempt. If, after that initial round of suppositories and patient waiting, nothing significant has passed or you still feel completely blocked, do not despair, and most importantly, do not immediately start pushing again. Gently get up and walk slowly around your home for 15 to 20 minutes. This gentle movement helps to stimulate peristalsis, those natural muscular contractions of your colon. Then, lie back down and repeat the entire process from step 1. Administer another round of suppositories, again 2 to 3 adult strength if clinically advised, and allow another full 30 to 45 minute waiting window. This second round of glycerin is often what is truly needed to soften not just the outermost layer, but to penetrate further into the dense mass, allowing it to begin breaking up and becoming more passable. Step 3. Warm water retention enema. If after 2 thorough rounds of suppositories, you still have not achieved satisfactory results, the next step, before seriously considering emergency care, is to try a warm water or saline retention enema. These are readily available over the counter as products like Fleet enemas or similar brands. Carefully read and follow the instructions provided with the product. Again, lie on your left side, administer the enema slowly and gently, and once more, hold it in. Do not rush to expel it. The primary goal here is to introduce enough fluid and warmth to further hydrate and loosen the impaction from above, providing an additional softening effect. Step 4. Emergency medical care. If all your diligent at-home attempts have been thorough and unsuccessful, and I want to emphasize the word thorough here because patience and adherence to the waiting times are truly required, it is absolutely time to seek professional medical attention. This means going to an urgent care facility, or depending on the severity of your symptoms and how long you've been impacted, an emergency room. This is not admitting defeat. This is making a smart, responsible, and rational medical decision to protect your health. At a hospital or urgent care center, the clinical team has access to far more potent and high-volume therapeutic enemas, with medicated solutions that are designed to penetrate much more deeply into the colon than anything available over the counter. They also have imaging capabilities, such as X-rays, to accurately assess exactly how extensive the impaction is and whether it extends beyond the rectum into the sigmoid colon or even further up the digestive tract. In cases where clinical enemas prove insufficient, and this does happen particularly with long-standing, very dense impactions, a specialist will perform what is known as a manual disimpaction. I want to be completely straightforward with you about this procedure. It is exactly what it sounds like. A physician using protective gloves and a substantial amount of lubrication manually breaks up and removes the impacted mass piece by piece from the rectum. Because the surrounding tissue is typically extremely inflamed and sensitive by this stage, this procedure is almost always performed under sedation or regional anesthesia to ensure your comfort and safety. While it might sound uncomfortable to hear about, I assure you it is a safe, routinely performed clinical procedure, and the profound relief patients report immediately afterward is, without exception, extraordinary. Recovery and what happens next. Once the impaction has been successfully cleared, whether through your diligent efforts at home or with professional medical assistance, your body will enter a brief recovery phase that requires your careful attention and continued care. For the first 24 to 48 hours following the disimpaction, the rectal tissue will likely be irritated, swollen, and highly sensitized. You may experience some localized discomfort, perhaps light spotting of blood, or a general feeling of rawness. This is an expected part of the healing process and will gradually resolve with time as the tissue recovers. A warm sitz bath, soaking the lower portion of your body in warm water for 10 to 15 minutes, 2 to 3 times a day, can provide significant relief from discomfort and actively promote tissue healing. During the first few days of recovery, your diet should focus on easily digestible, soft, and naturally fiber-containing foods. Think comforting oatmeal, well-cooked vegetables, ripe bananas, and nourishing soups with soft vegetables. It's important to avoid anything that is overly dry, tough to chew, or low in moisture, as these can easily contribute to further constipation. And critically, make a conscious effort to drink water consistently and deliberately throughout the entire day, even if you don't feel particularly thirsty. Regular hydration is paramount to preventing a recurrence. This period, while the memory of the experience is still fresh and impactful, is also the ideal moment to take proactive steps for your long-term digestive health. Schedule a visit with your primary care physician to thoroughly review your entire medication list, specifically looking for any drugs that might have constipating side effects. If constipation has been a recurring and challenging pattern for you, ask your doctor for a referral to a gastroenterologist, a specialist who can formally evaluate your colonic motility and identify any underlying issues. Furthermore, if you haven't had a colonoscopy within the recommended time frame for your age and risk factors, this is an incredibly important time to ensure that there are no structural causes for your constipation, such as a narrowing of the colon or a growth that might be affecting the passage of stool. Before we move on, I'd love to hear from you in the comments. Tell us a bit about your health condition and your age. I genuinely read and reply to every single comment, and your input helps create a supportive community. If you found this video helpful, please press that like button and subscribe to the channel so you don't miss future important health discussions. Long-term prevention, building a strong foundation. I want to conclude today's conversation with what is arguably the most important message I can possibly convey. What we have discussed up to this point has primarily focused on crisis management, what to do when an impaction has already occurred. And while crisis management is absolutely critically necessary in the moment, it should never, ever be the ultimate goal. The true goal, the foundation of lasting health, is to build a life and establish habits in which this painful and dangerous crisis never happens again. Long-term prevention of fecal impaction in older adults rests firmly on 4 interconnected and equally vital pillars. Pillar 1. Hydration. Water is, without a doubt, the single most powerful and effective tool your colon possesses for keeping waste material soft, pliable, and easy to pass. Make it your consistent goal to aim for at least 6 to 8 glasses of water per day. If drinking plain water feels difficult or unappealing, remember that warm herbal teas, comforting broth-based soups, and a variety of water-rich fruits and vegetables, such as watermelon, oranges, cucumbers, and berries, all contribute significantly to your daily fluid intake. If necessary, set alarms on your phone or use a dedicated water bottle with time markings to remind yourself to drink regularly. Make hydration a deliberate, non-negotiable habit. Pillar 2. Movement. You do not need to train for a marathon or engage in strenuous, high-impact exercise. The simple act of a brisk 20 to 30-minute walk daily is genuinely one of the most powerful and beneficial things you can do for your overall digestive health. As we discussed earlier, gentle physical activity mechanically stimulates the digestive system, helping to keep intestinal contents moving smoothly. If walking presents a challenge due to arthritis, balance issues, or other physical limitations, even gentle chair exercises, simple stretching, or swimming can significantly help maintain crucial intestinal motility and muscle tone. The key is consistent, mindful movement. Pillar 3. Dietary consistency. Incorporating a consistent amount of soluble fiber into your diet is essential. Soluble fiber found abundantly in oats, many fruits like apples and pears, legumes, beans, lentils, and a wide array of cooked vegetables adds critical bulk to your stool and, importantly, retains moisture, keeping it soft. If you are not accustomed to a high-fiber diet, introduce fiber gradually over several days or weeks to avoid potential discomfort such as gas and bloating. Additionally, try to make your meals a consistent routine. Eating at roughly the same times each day helps your intestines establish a regular rhythm and predictable pattern of activity, supporting healthy digestion. Pillar 4. Scheduled bathroom time. Understanding and utilizing your body's natural rhythms is incredibly powerful. The gastrocolic reflex, which is the natural signal your colon sends to prepare for a bowel movement after eating, is often strongest in the morning, typically within 30 to 60 minutes after breakfast. Capitalize on this natural reflex. Make it a conscious practice to sit on the toilet at this specific time every single morning, even if you do not feel an immediate strong urge. For optimal physiological positioning for elimination, use a small footstool to elevate your feet slightly. This helps straighten the angle of your rectum. Give yourself a relaxed 5 to 10 minutes, without rushing, without straining, and without distraction. Over time, your body will gradually relearn and reestablish this healthy rhythm, making bowel movements more regular and predictable. A crucial word of caution regarding stimulant laxatives. I understand their appeal. They work quickly, they are easily accessible, and they provide rapid relief from discomfort. However, long-term daily reliance on stimulant laxatives can unfortunately train your colon to become dependent on artificial stimulation. When you eventually stop taking them, your colon may have largely forgotten how to initiate movement and contractions on its own. This condition is known as cathartic colon, and it is a real and well-documented consequence of prolonged laxative overuse. There are far safer, more sustainable, and gentler options available, such as osmotic agents, which draw water into the bowel, stool softeners, and various fiber supplements that your doctor can recommend as part of a personalized and sustainable plan for your long-term digestive health. I know this has been a comprehensive and perhaps at times a challenging conversation today. I understand that some of the information might not have been easy to hear or discuss, but I believe deeply that the most important health conversations we can have are often precisely the ones that feel the most uncomfortable. You deserve to fully understand what is happening inside your own body. You deserve to have a clear, actionable plan when something goes wrong. And most importantly, you deserve to know that whatever you are currently going through, you absolutely do not have to figure it out alone, and you certainly do not need to feel embarrassed about it. If you found today's video genuinely useful, informative, and empowering, I would humbly ask you to do just one thing: share it. Send it to a family member, a friend, a neighbor, anyone in your life who might be quietly suffering with this difficult condition and not saying a single word about it. This video might just be the exact resource they have been searching for, but perhaps didn't know how or felt too ashamed to ask for. Please click the like button if this helped you, and subscribe to the channel so you never miss our upcoming videos on vital digestive health topics, strategies for healthy longevity, and how to take real, proactive control of your health as you age. Take good care of yourselves, remember to drink your water, keep moving your body, and I will look forward to seeing you in the next one.